Hi friends, I am Anita, one of the trainers at the AZ campus for English language. Today we will discuss regarding the OET speaking module, one of the easiest subtests in the OET exam. However, our students have so many issues regarding the speaking. So here we will discuss some of the things which will be helpful for you during the exam. I will insist you to speak more in English because the more you practice speaking in English, the more So during the OET speaking test, you should try to use the most relevant vocabulary, phrases, signpostings, reassurances, and the most polite and empathetic way of dealing with the patient. You may know that the OET speaking consists of mainly 3 subtests. There will be a warm-up session which will last from 2 to 3 minutes, which can have questions related to you. And another 2 subtests will be on the role play cards. There will be 2 role play cards for you, and you will be given with 3 minutes for preparation and 4 to 5 minutes for speaking on the same role play card. Once you get the role play card, try to understand the setting and whether it is a known or an unknown case. Based on these things, the introduction portion of the roleplay card may change. For example, if the setting is a hospital ward and if it is a known patient, you can avoid the self-introduction. You may start the conversation by addressing the patient name. For example, like, "Hi John, how do you feel today?" And if it is an unknown patient, you may need to introduce yourself to the patient and then find out the patient identity. After that, you can address their concerns and specific questions and give solutions for the patient. For instance, you can start like this. "Hello, good morning. I'm Anita, one of the registered nurses working in this ward, and I will be taking care of you today. For my confirmation purpose, could you please tell me your name and age?" Now I am going to the most important aspect of the OET speaking, which is going to reward you with the score above 350. Try to utilize all chances to appreciate, to thank, question, ask permission to the patient. Now I am going to the most important aspect of the OET speaking, which is going to reward you with the score above 350. Try to utilize all chances to appreciate, to thank, and to ask permission to the patient. Show empathy and give reassurances. Make sure that you address the patient concern and try to give solution after acknowledging their concern, which is very important in giving a good score. I would say that the smooth transition between the bullet points is as important as addressing the patient concerns. But always prioritize on listening to the patient and giving solutions as well as reassurances whenever possible. Make sure to ask the patient about his concerns and regarding his awareness about the condition. You may ask questions and encourage the patient to open up. Here are some tips which will help you to communicate effectively with the patient, which is considered to be more important than your fluency in the language. In OET, we can say that more than being a speaking test, it is a communication test. More than focusing on your language proficiency, it focuses on your clinical communication skills. So here you need to listen to the patient. You may have to give information which he or she needs. So we can say that it is a two-way communication, unlike in the other English tests like IELTS. Make sure not to repeat the questions in both the role play cards. Try to include more expressions and try to give different conclusions at the end of the topics. So here are some such questions and expressions which may help you during the speaking test. How are you doing today? How may I address you? I can understand your concerns. Please don't be worried about so and so problems. I will definitely help you with that. As I am here now, I will definitely address your concerns. I hope I have melted away all your concerns. I hope it's clear for you. Is there anything else that I can help you with? Your concerns are quite reasonable. I appreciate your decision. Thank you for answering my questions. Are you bothered of anything else? Do I need to address any other concerns for you? I do appreciate that you are going through a difficult situation. It must be frustrating for you. Okay, friends, we will update with the continuation of this topic in the next session. Thank you.